I think that the opioid crisis, for lack of a better word, has taught us once again that history repeats itself. We have gone through this in medicine over and over and over again, where we say, here's a medication that's going to be great and not have any problems, and yet we find out it's addictive, or we find out that it has other consequences we didn't anticipate. Now, part of that is just the learning process of a medication that comes to our use. But I think that many people could have predicted over the centuries that, well, this medication might be problematic, or this substance is going to cause certain issues like addiction. And it really should not be a surprise to people that opioids are part of the addiction spectrum, and that we wouldn't find ourselves in this very place if we had thought about it 20, 30 years ago. So this should have been an expected consequence, and it should have been something that we prepared for and studied in real time rather than finding ourselves in the mess that we're in. Now you hear a lot of talk about marijuana, ketamine, other potential substances that we know have reinforcing properties. We know that people abuse. We know that they do other things than just alleviate pain in a narrow bandwidth. And so I think that we have to stop and ask ourselves, are these really the substances that we want to promote? Are these really the substances that we think are going to be the magic bullet panacea? They won't be. We almost certainly know that that's the case. And so there is no single intervention that is going to tackle this whole problem. It's just too multifaceted, and it's too universal a complaint that has tremendous variability beneath it. That's going to require a much more sophisticated compendium of treatments and formulations of treatment than a medication can offer. And I think there's a lot of excitement about these things, and there should be at the research level, but I think we need to be quite cautious when we prescribe them to patients because of their other effects. And I think that we should always remember that patients are vulnerable, and patients are desperate for a relief, and a relief that can come quickly, and they are willing to do things that they might not really decide to do if they weren't a patient who is suffering. And one of the things that we must always be is an advocate for our patients and a protector of them when it comes to treatments that are less than clearly efficacious.